care practitioner and a man with a voice that is strong and steadfast. He knows what it means to put himself out there for the profession that he loves and the patients that he serves. Let's take a look at this video.
I'm excited about the opportunities, the places we can take pharmacy. Members of our association are extremely excited about provider status, and we've really started a lot of momentum. I hope that we can increase with advocacy and pharmacists across the country giving the right message to the right places to the right people, that it's the right thing to do for patients. We will be able to achieve being critical members of healthcare teams, interprofessional collaborative practice, provide better health for a healthier nation and healthier patients, and pharmacists are recognized for being part of that.
Ladies and gentlemen, please welcome the man who will guide the association in the coming year, President-elect Steve Simenson.
How are you doing today, Mark?
Great, thank you. It is all yours.
Thank you.
Have fun.
I will. Thank you for giving me this amazing opportunity to serve as your APhA president. Pharmacy has given me so much. The opportunity to treat and heal patients, a rewarding and challenging profession, and a network of talented and dedicated peers. Thank you also to my family, my pharmacist wife Wendy, who has encouraged me, kept me focused, and listened to some pretty silly, wild ideas as we've discussed pharmacies. My son Forrest and our new daughter-in-law Carolina, an advanced practice nurse practitioners, who I would love to work with us in our team-based care model in Minnesota. And my Goodrich pharmacists, residents, student pharmacists, and staff, who have helped us reach new milestones in improving patient care. My mom, Catherine, who has always encouraged me to focus on doing the right thing. Hi, Mom. And to other family, friends, and colleagues who are not here today. Importantly, thank you to our predecessors. My career and our profession are better for your efforts. To my immediate predecessor, Janelle, you provided endless energy in this game-changing times. I would like to acknowledge the association leadership, staff, and peer collaborators who are here today. I look forward to working with you. This is a great team of advocates for our profession and for our nation's patients. And finally, I have to thank Mark Wahlberg for his kind introduction, as well as unknowingly providing some inspiration for my comments this morning. Most of us know as Mark is the host of the Antiques Roadshow. I think this makes him uniquely qualified to MC for a profession whose roots go back 3,000 years. The etymology of the word pharmacy dates back to the ancient Greek word pharmakia, the occupation of sorcerers who dispensed potions and poisons and also presided over ritualistic human sacrifices. What a great job to bring to the negotiating table. Fortunately, our predecessors have been savvy enough to recognize that change is an integral part of the engine that moves our profession forward. Today, we recognize that our profession must, unlike an antique, evolve with the changes in healthcare, and APhA is out in front of that effort. Through APhA, we have strengthened the role of pharmacists, documented the value pharmacists provide, and made progress toward establishing MTM as the norm. I'm a practicing community pharmacist who provides patient care services every day in team-based care. While we've had successes in my practice, we have much more work to do. In our 7 community pharmacies, we have demonstrated with perseverance, innovation, and focus, we can create value to patients and other healthcare providers through a variety of patient care services. We participate in medical homes and have two-way access to electronic medical records. These experiences help me see our vision as the stars align. You told your APhA leadership attaining provider status was an important issue, and we listened. We have a multi-year, multifaceted, big dollar spend committed to make this happen. APhA is working with colleagues within pharmacy, medicine, payer, and consumer communities to help them understand and recognize the value we have to contribute to meeting quality, cost, and outcome goals. It's important that as a profession, we are totally committed to this task. We are working with state and national organizations in pharmacy to adopt a set of principles to guide this effort and to communicate to pharmacists' value to decision makers. We have co-sponsored a forum at this annual meeting focused on gaining consensus on the principles of our campaign. About a year ago, Mark Wahlberg published an article in the Huffington Post in which he described how his experience on the Antiques Roadshow has helped him realize what is truly valuable. He points out that it's not the Tiffany necklace or the Stickley furniture that has value, but rather it's the people and the connections he has made with them. So too have pharmacists come to understand it's our patients who give meaning and value to our work. We are no longer just dispensing medicine, we are also dispensing care to our patients. Yet we have a challenge to be recognized and valued as a patient-centered care providers aligned with a vision of pharmacy practice, and a challenge to be recognized and accepted by the public, payers, policymakers, and our peers as healthcare providers who contribute to improving access, quality, and value to healthcare. Our message must resonate with the patient, the ultimate beneficiary of our services. How could any reasonable person deny these services? But we also need to do this with those who are footing the bill. We have to educate decision makers who do not directly receive our services to see the value we provide to the health system and the ultimate recipient every day. Unlike the individuals who unwrap treasures for the appraisers on the Antiques Roadshow, it is we, not the appraisers, who must point out the value of our treasure. We cannot stand idly by when the average member of Congress stumbles over how to differentiate between a pharmacy and a pharmacist, and furthermore, assign value to something they can't measure. While the number of petition signatures will hopefully generate a meaningful response, it is one small step that we need to attain the recognition we desire. Individually, we need to do more and better talking. You need to use your voice to promote what pharmacists can do. I've used this strategy in my practice, and it works. I'd like to propose a simple elevator speech to quickly demonstrate pharmacy's contribution to improve access, quality, and value in healthcare. The key messages are who we are, the benefits we provide, and the actions that will bring success. It could be targeted to any audience, but this one is focused on the federal sector because we want pharmacists to be recognized on the list of providers in the Social Security Act. This allows us to participate in the team-based delivery of care and serve as a model for other programs. Yesterday, President Sabatka said that we need to help ensure pharmacists are the game changers in our healthcare system. I agree, and I plan to work this year to encourage you to start talking more using this pitch and other APHA resources. Our voices have to be heard by our peers, by our communities, and in Washington. Now to the elevator's pitch. Let me ask our new pharmacist, Mark Wahlberg, to join me on the stage. This will be Mark's training session, as he now will be the co-host of Pharmacy's Roadshow.
Which is going to be a hit.
It absolutely will be a hit.
You bet. I'm ready, so we're in the elevator.
We're in the elevator. Short and sweet. Listen up. It's important.
Very scary elevator. Open, open, open.
Good morning. My name is Steve Simenson, and I'm a pharmacist from Minnesota.
Hello, Steve.
Nice to meet
I'm
you.
a pharmacist from Los Angeles.
Well, how'd you do that?
Well, it was quick. Anyway.
It's important to patients to have access to pharmacist clinical services. It's a smart spend that pays. Patients with complex medical conditions benefit from pharmacist clinical services. Literature and practice-based experiences show that when pharmacists get involved, when healthcare costs go down, while quality and patient safety measures improve. Unfortunately, the Social Security Act does not recognize pharmacists as a provider to receive payment.
That's ridiculous.
You're absolutely right. To help with other healthcare spending, Medicare must include pharmacist collaborative services. Pharmacists need to be recognized in the Social Security Act. It's a smart spend that pays.
Doctor, I concur.
Thank you, thank you.
Thank you very much. Well done.
Thanks, Mark. Now let's analyze the components of the pitch. Washington needs to hear from real people. There's a term in Washington for fake grassroots organization. They call it AstroTurf. It's important that your voice be authentic. It's important that you offer real-world perspective. And it's important that you be connected to a vote. It's your strong voice that is going to help this profession and our legacy. It's important for your message to connect with a broader challenge. In this case, it's the nation's fiscal crisis and continued economic struggles. We have some evidence of the cost savings that come with leveraging pharmacists in patient care, and Washington relies on economic analysis to determine benefits. APhA is planning a simulated congressional assessment of the value and costs of including pharmacists in the Social Security Act. Patients with complex medical conditions benefit from pharmacist clinical services. And literature and practice-based experiences have shown that when a pharmacist gets involved, overall health care costs go down while quality and patient safety improve. The report to the U.S. Surgeon General supports pharmacists delivering patient care services through collaborative practice agreements. It's an accepted model of improved healthcare delivery. In addition, the APhA Foundation's research and innovation efforts continue to incubate patient care improvements and systems change. In Project Impact Diabetes, we are gathering patient data and testimonials that help us articulate pharmacist patient care services impact. While facts and figures are important, it's your personal stories that grab the heart. To optimize our healthcare spending, Medicare must include pharmacist collaborative services with other providers. Pharmacists need to be recognized in the Social Security Act, and it's a smart spend that pays. But here's our challenge. Our patients know the care we provide and the value we add to their lives. And other healthcare providers are beginning to see the same and count on us as key members of the healthcare team. But payers and policymakers have yet to realize it. A great change for our profession, and most importantly for our patients, can be made with simple yet hard-to-get tweaks in existing law. To get the most value for their healthcare dollars, patients need policymakers to add pharmacists to the list of providers in the Social Security Act. Patients need pharmacists to be specifically named in any new payment model created within the provisions of the Affordable Care Act, and innovative practice models need to incorporate pharmacists as valued members of the healthcare team. To make these changes a reality, pharmacists need to recognize their own potential and take action. To paraphrase the quote, "I'm mad as hell and I'm not going to take it anymore." Say it with me. 1, 2, 3. We're mad as hell and we're not going to take it anymore. Today's standards for pharmacy education require pharmacists to be ready for practice when they graduate. We polish our skills on the same playing field as all newly graduated health professionals by taking care of patients. Many pharmacists have proven themselves after a career of taking care of patients. Experience, knowledge, and skills will and should all play a role in positioning pharmacists on the healthcare team. When it's all said and done, it comes down to us. Pharmacists to improve patient health outcomes and provide value and cost savings will be recognized. Near here, you'll find the Heritage Square Museum. It exhibits a 19th century drugstore. It has shelves of old cures, a soda fountain, and a counter with stools. As fascinating as it is, it scares me a little. It displays items from defunct pharmacies, and it shares many of the same features of one of my own 19th century old pharmacies. Without innovation, we'd be a museum piece too. But building on the relationships and collaborative practice we have established, I've collected many examples that support the inclusion of pharmacists as valued members of the healthcare team. I'm still working on complete and adequate valuation of my services, but I know we have a strong case and see progress every day. It takes a lot of hard work, exploring opportunities, but it can be done. For a long time, you have used your voice, just as I have, to serve your practice. Our legacy is healthier patients. In order to keep this legacy in a changing and evolving healthcare system, we need you to use your voice to articulate what pharmacists can do. We need you to keep walking and talking and even shouting until pharmacists are recognized as the healthcare team member responsible for ensuring optimal medical therapy and outcomes for our patients. In the coming year, I pledge that I will work on building that case. Join me on this journey. I'm counting on you to step up and use your voice for our profession and our patients. If we do so, our legacy will be a better association, a stronger profession, and a healthier nation. Thank you.